All right, so good afternoon. How wonderful to see all so many faces in person. I mean, I haven't done an in-person meeting in a long, long time. So, as I mentioned, I'm Chris Taylor with the Bank of the Rockies. I've been there for about 12 years. And I'm here with Blake Bigger, and we're going to talk a bit about our programming, our organization. I'm going to hand it over to Blake to touch on our Food for Health program. So a little bit of information about us. So we are one of 200 food banks within the Feeding America network. Something I just learned the other day is we have the largest geographic area of all the food banks within the Feeding America network. We have 4 distribution centers. We serve 32 counties in Colorado and all of Wyoming. So we've got 2 distribution centers in the Denver area, 1 in Grand Junction, and then 1 up near Casper, Wyoming. The rest of the state of Colorado is served by 4 other of our sister food banks. Care and Share of Southern Colorado, Community Food Share, Food Bank for Larimer County, and Weld County Food Bank. So last year, we distributed over 80 million pounds of food through our programs and our partnerships. And this is 55 counties of our service area. And one program that I forgot to add to this bit is our partner support program that works mostly with all the nonprofits that get food from us, including Village Exchange Center. And we also do mobile pantries, about 70 of those a month, service area wide. We have our Everyday Eats program, which is the free food for older adults who qualify based on age and income. TFAP, the Emergency Food Assistance Program. Child and Adult Care Food Program, we're a sponsor with the state, doing after school meals. SFSP, Summer Food Service, which is our summer meal program for kids. Toast to Hope, which is our weekend backpack program, and Food for Health, which Blake will touch on in a minute. So some of the types of organizations that we partner with that get food from us is our food pantries. We work with a lot of churches and standalone food pantry organizations, soup kitchens or meal centers, shelters, senior housing, housing authority, different kinds of apartment buildings, senior high-rises, for example, schools, libraries, rec centers, you name it. Pretty much every type of organization you can imagine get their food from us to serve directly to their neighbors in need. And the last piece I'll touch on is we do have SNAP representatives that work for Food Bank of the Rockies. We are partnering with Hunger Free Colorado, and we serve essentially most of our service area in Colorado with SNAP outreach. So we can go to your organizations, we can set the table, we can do SNAP applications over the phone or in person, and both of them are bilingual. The picture behind me is Yolanda, and she sets up sort of office hours every Monday at Tapayek Family Health in Denver, and people can come in and do SNAP applications with her, or just she can answer their questions. And the last bit that I'll touch on is we do love our volunteers. We use about 100 volunteers a day. So if you as an individual or your organizations want to come help us out, it's actually a really fun atmosphere. You can do everything from pulling orders for our partners, you can sort through produce, we have office work, so you name it, we got it, and we always would love the help. You can just sign up on our website. For partnership information, you can also go to our website if you're an organization that wants to partner with us. And last but not least, if you have anyone in need of food assistance, please refer them to our website. I put some cards on the back table, our Find Food cards. You can hand those out. I also have flyers for our SNAP outreach team and a brochure more about our programs. And we'll give it over to Blake.
Thanks, Chris. Hi everyone, I'm Blake Bigger, Healthcare Partnership Coordinator. Been in the food bank for a little over a year and a half. So let's talk about our Food for Health program. The goal of the program is to reduce barriers, increase access to nutritious foods, reduce food insecurity, help improve those with complex medical conditions. Just a little conceptual model of how food as medicine programs typically work. Identification of food insecurity, the clinical screening, referral from the healthcare provider, enrollment in a food as medicine program, and then focus on improving diet quality, food security and clinical satisfaction, working around dietary strategies, and then improving the health and looking at utilization outcomes. So the Food for Health program is essentially a referral-based program. We have the healthcare provider screen their patients for food insecurity. We provide a heart-healthy, diabetic-friendly, nutritionally focused, and culturally responsive box of food, which includes a 5-pound bag of fresh produce. So, of course, as I said, the goal of the program is to build relationships with trusted healthcare partners, and we partner with medical clinics, hospitals, federally qualified health centers, and we connect them with supporting healthcare organizations. We work around the social determinants of health, as well as part of the hospital transformation program. So we launched our program in October of 2022. As of now, we have about 240 people receiving deliveries, weekly deliveries. Of those, we've had 86 patients complete the program, so it's a 1-year program. They receive a box of food and produce once a week for 1 year. Our current partners are Clinic in Colorado, that's how we met Ryan, Luther Medical Center and Platte Medical Center, which are part of Intermountain Health, Denver Health, Denver Indian Health and Family Services, which supports those American, Indian, Native American, indigenous populations, and then St. Anthony North, which is from Common Spirit. The 4 preventative care, the diagnoses that we focus on are prediabetes, type 2 diabetes, cardiovascular disease, and hypertension. And then some additional healthcare partners outside of the Food for Health program. Children's Hospital, we have a food pantry there, North Suburban Medical Center, mobile pantry, and then as well as our UC Anschutz Medical Center's food pantries there. So how it works. Patient meets the targeted medical conditions. They screen the patients for food insecurity using the Hunger Vital Sign 2 items survey. And then at the bottom, these are the questions within the past 6 months. Were you worried about running out of food before you could buy more? And second question, within the past 6 months, the food that we didn't last, and we didn't have money to buy more. So what we provide a rotation of nutritious food boxes, which includes fresh produce. The food boxes have whole grains, low-fat milk, canned fruits and veggies, canned tuna or shelf-stable chicken. We'll have some spices or seasonings, and then nutrient-dense snacks as well. So once a week for 1 year, they receive a food box. We work with Bull Runner and DoorDash for our deliveries. Bull Runner is a local courier service that we work with. They've been really great. They get accustomed to the routes. They get familiar. They have that face-to-face interaction with the patients. And then we also connect them with other resources, including SNAP, Everyday Eats, which is another home delivery program, and additional food pantries. This is a sample of our newsletter. Thanks to Janelle, who curates these newsletters for us. At the top, it's a nutrition education piece, and then at the bottom is a recipe that we add to the newsletter. They are bilingual, and then we also provide them additional research, additional information for food assistance. And these are 3 participants in the program. Sam is on the left. He's from Denver Indian Health and Family Services. Middle, that's Rochelle. She is from Denver Health. And then on the right, that is Mitch from Luther Medical Center. Just a little bit of a response rate. 94% responded that the program has made an impact on their understanding of their health. 94% of program participants report being satisfied with the food box program. 98% of the time.
Oh dear, yeah, take it down.
Well, I think I can speak loud enough. This is the last slide. So yeah, 98% of program participants reported that being in the program has made them and their family feel more food secure. And that wraps it up. Open for questions.
Yeah, you mentioned the UC Medical Center food pantry.
Nice and loud for online.
That's on the Anschutz campus?
It is.
Where is it on campus?
Where is it?
Yeah, I'm not really sure that they're not super active. I think it's mostly for employees.
For what?
For their employees.
Oh, okay, yeah. Thank you for clarifying that.
And so for individuals who may potentially want to partner with you all,
Yes.
especially for the mobile food pantry or boxes being delivered to those who are unhoused along the Colfax corridor a little bit further west, how do we engage in a partnership with you all?
So there, and I can give you my card. So there's a application process. So you would just apply to become a partner. We're not expanding our mobile pantry program currently. We have like about 70 of them that happen throughout our service area. At least 40 are within the service area in Colorado. And so you can refer your neighbors to those locations. But if you're looking at opening a food pantry partnership with us, we can set up the application process with you.
Thank you.
You're welcome. Yes?
And then I just didn't get a chance to write everything down, but is that list up on your website of just the current partners that I specifically for families?
Yes. Yeah, like I said, we have I've got cards in the back, the Find Food cards, and so that'll list all of our, I shouldn't say, it doesn't list all of our partners, it only lists those partners who are receiving new neighbors. Not all of them are open sites. We might have some group homes or some residential programs that are closed, but it does give information about all of our food pantries and meal programs.
And we just launched a program page on our website, so you can access that for any additional information.
Anything else?
That's it.
Okay, great. Thank you so much.
Thank you all.
Okay. Well, my name is Elisa Aucancela, and I'm the co-executive director of El Grupo Vida. And El Grupo Vida is, our mission is to empower immigrants with disabilities and their families with information, training, and direct advocacy to help them become more self-sufficient and give our community a voice, raising awareness about our rights. And meet the team. This is the team. Sometimes it's very funny because they're like, oh, you are like 20 people. No, we are not 20 people. We are, that's and our new co-executive director is Jose Vega. We have Albina, Denise, Alfredo, and Christian, that they are community navigators. And what we do, and you can have one of our brochures. It's in English and Spanish. And one of the things that, yes, you can kind of, Grupo Vida has been for more than 30 years, and it started with two moms. They say, we don't have a lot of information in Spanish, let's support each other. And for most of that 30 years, was just only support group and one conference per year. Well, this shift to a welcome center and to have a variety of trainings, activities, picnics, and this amazing resources center, welcome center, that in October sends to Mandy and other group of empowered women that we were kind of, okay, what we need to do or what things we have. Thinking about new arrivals, we were talking about let's do something different, And we talk about the exchange boutique. And what is the exchange boutique? You don't need money to go to our exchange boutique. If you want to bring things, you are welcome to bring things. If you want something there, you are welcome to take things that you need from the exchange boutique. And it's a process of two ways. Sometimes we are so used to give and the person to receive, but we don't have, or we have few opportunities that the person who receives also can give. And this is one of these opportunities. They have the opportunity of give time. And currently this is leading by volunteers. And I will show you how it looks. Now it looks much better. So excited. Yeah, it started like, somebody asked me like, okay, Elisa, when are we done with the boutique? And I'm like, I don't know. Because every time that it's almost empty, something happened that starts to be full again. And we are like, okay, we're still having our exchange boutique. The exchange boutique also brought food. And we have a small food pantry, the same thing. The community has been bringing different type of food, and then we have partnership with Recycle, then we have diapers. And every month we have between, well, last month was 330 families who came to receive diapers, but also came for the boutique and also for the pantry. Therefore, every month is like go like very low, and then, or again, miracle, we receive more and more. This brought not just only clothes, but also wheelchairs. Brought a lot of things that parents have, and we are now kind of this middle, I say woman, no man, middle woman. We're this middle like of parents need something, or this family needs something, and we're kind of this middle thing like, okay, who has this, who needs this, and we are connecting the people. Also, we have been working a lot with new arrivals and what things they need, from wheelchairs to connection with health system, housing, with a lot of things, but this is for other time. And training. We have first aid and CPR in Spanish. We have, this is a training that is in English, and you can enter many phases of autism. You can do it, it's free, it's amazing, but we don't have it in Spanish. Therefore, we do it in Spanish for our families, and they have their certificate. We have an entrepreneur training, photography and mobile video classes, another type of classes like basic computer training, Canvas and social media, cyber security, parenting class, educational workshop, English classes, and consultation, advice, training, and translation in the transition to adulthood, special education, IEP support. And one thing that we provide with the program for the community navigator is connect families with children, young adults with intellectual developmental delays with the agency that now they change, correct? Our agency like developmental pathways, like Rockies and Human Services, to see if they can receive services through waivers or to state waivers. In that case, we go through that process that they apply for services through Medicaid waivers or state waivers. And these resources and supporting health, education, immigration, government, support and community board application, housing, and mental health. And of course, we need to do community activities, because if not, we are in trouble. And this is one of the resources workshop that we did for new arrivals. We brought families that were in shelters, and we brought a variety of organizations. Colorado Access was there, and we were like, okay, we need everybody here, they need to know what is in the community, and was amazing, and was kind of a process of connections to the services that we have. Other activities, the conference, we have a youth conference and we have a parents conference. All of these activities are in Spanish with interpretation in English. And our support groups, we have one support group on the second Saturday of every month, and we have virtual support groups. This one, I love it. This is my favorite. This was our past youth conference. It was amazing because something that they did, and they were so fun. This was one of the classes that they took, that was photography. Next activities, again, diapers, and our support groups, and our contact information. Questions?
Here you go, Rich.
Yeah. A question on the new arrivals who are asylum seekers. Children, they're not TPS, they're not under TPS, but my understanding is the children do qualify for Medicaid if they're asylum seekers. They're not asylum seekers, they're asylum seekers. What is your understanding?
At this moment, we connect them with the different organizations who know more about what they can access. We are waiting for January 1st, 2025.
Yeah, everyone's waiting for that.
Yes. It's kind of tricky. We observe that some families, for different situations, depending on Medicaid emergency, we have families with children that needed open heart surgery. And they were able to have a Medicaid emergency, but others that have just only discount. In that case, I feel about your question has been case by case. I didn't see any pattern of I apply for asylum, I automatically receive Medicaid.
No.
I didn't.
No, Rhea, you don't happen to know that, do you? Do asylum seeker children under 18?
As far as I know, no, because it's, well, the application is pending, it's still, really, they don't have any status. And so it's not until the application is approved.
You? I recently had a chance to visit El Grupo Vida and drop off stuff, and I just want to say how impressive the exchange closet is, and exchange boutique, is, and I would encourage folks to go and donate stuff, and it's really cool.
And you're welcome. If you want to see it, again, it's so small. I was surprised. I went to other organization. I'm like, oh my gosh, we're so small. But we are really good organized. I'm so proud of my volunteers that they like.
It's so impressive. And for someone who is done having babies, who didn't want to get rid of winter clothes, I know that they're being used. So that if that helps any hoarding moms out there. Any other questions?
Car seats.
Thank you. Thank you. And one last thing, of course, our sponsor, because one of them is here on Developmental Pathway. They're amazing. They support the work that we do at Rocky Mountain, Pasco, Elisa, and Park Thrift Store. Okay. One question? Okay.
Thank you.
Yay!